Hi, I'm Layla from HR.com. If you are joining us for the first time today, welcome to day 2 of Inspire and welcome back to those that have rejoined us. Have a look around and tune in to the valuable learning sessions and networking times. Check out the event navigation guide and get the most out of the event. I will post a link to the exit survey in the chat area. And the presentation slides will be available in the archived version of this event on HR.com. If you have questions during the session, simply add them in the Q&A on your webinar controls. There will be time for live answers at the end of the session. You will also notice the chat features, which you may use to engage with attendees and panelists. We love hearing your comments. This session is How Employees Can Break Down Stigmas Around Mental Health, presented by Haeli Harris and Amelia Wilcox. Haeli Harris is a licensed marriage and family therapist, LMFT. She has studied human development, families, and relationships for 20 years and has over 10 years of experience in the mental health field, working in a therapeutic environment with individuals, couples, and families. Amelia Wilcox is the founder and CEO of Nivati, the high-growth mental health platform that provides the easiest way to understand and manage employee mental well-being. It's now my pleasure to turn it over to Haeli and Amelia.
Hello, I'm so excited to be here. Just to get started, I would love to just know where people are coming from. So if you want to just hop into the chat and just post your city and state, I would love to just kind of get that conversation started and see where everybody's coming from. I'm located just outside of Salt Lake City, Utah, and Haeli is, I believe you're in Salt Lake City, Utah as well.
Yes, I am.
Awesome. Yeah, we got people from all over the US. This is so great. I see all your guys' comments coming in, so thank you. Anytime you have a question during this presentation, I know there's a lot of us on the call, but we want it to feel conversational. We want to make sure we get your questions answered, so don't be shy throwing your questions up in the Q&A. And then we have a little bit of time at the end where we're going to go ahead and address some of those. So we've got people from all over. This is so exciting. So before we get started, I am going to actually put up a poll. So I really want to understand what your biggest challenges and priorities are in your roles in HR. So we're going to go ahead and throw that up there right now and give you just a minute to get those questions answered. So just what are your top priorities, challenges as an HR leader today? So go ahead and just pick whatever those are. We can kind of get that poll and get a feel of where everybody is at right now. Awesome. It's so fun to watch them come in. And I'm going to share my screen while you guys are doing that. Okay. Awesome. Okay, thank you guys. Looks like we've got about 75 people so far. So it looks like morale and retention is the winner. So it's mental health is the second place, looks like on here too. So it's really good to know where you guys are at with those kind of priorities. That helps me make sure I'm addressing the right areas for you today. So just kind of leading into a little bit more about who I am and who Haeli is, we work at Nivati. We have a mental health and well-being platform. We actually provide our services for companies in 28 countries. And counting. So it's been a really fun ride and we absolutely love what we're doing. Super excited to just be in this space and be able to help people in such a meaningful way. So I'm going to kind of start off with a story just to get this kicked off. And this is my dear friend, Shannon. She gave me permission to share her story with you all today. She is an Olympic skier. So she's retired now, but she's an Olympic mogul skier, gold and silver medalist. She skied all over the world. She's got 2 little babies and she's a ski instructor. She's an entrepreneur and a brilliant public speaker. Public speaking is what she loves the very, very most. She just thrives on that energy that we have with live in-person events, walking across the stage and then helping employers improve their teams. So she does a lot of team building with her company. So she and I have known each other for about 5 years now. We work together, we play together. Our kids are friends. We've seen each other through thick and thin. And Shannon and I were sitting on a Zoom a couple weeks ago on a Thursday night with a couple of our entrepreneur mom friends. And we chatted about things that were going well and things that were very challenging for us right now. So all of us are extroverts, and we're really, have struggled over the last year with social isolation, having our kids do online school, all of the things everyone struggled with over the last year. But what's interesting about what's happened to Shannon is, she has this amazing corporate team building company that's run by Olympians. And she actually broke down into tears and described this heart-wrenching pain of loss that she was experiencing from her entrepreneurial dream basically seeming dead overnight. It just kind of stopped in its tracks. And, because of that, she shared the weight of that financial pressure she was under to pay for a life she could no longer afford. And because of those challenges, there's this hopelessness, and her marriage is under strain. And so not only has she been physically isolated, she's been emotionally isolated as well, and just felt completely alone in her pain. And the stress is so bad for her that she actually had to get a mouth guard because she was chewing on her tongue in her sleep. And then she sent us this picture of her with these gloves on, just laughing at herself because she has to wear these gloves to keep herself from picking the skin off her fingers, which is this stress response because her anxiety level is so bad. She doesn't even realize she's doing it. And now Shannon is one of the healthiest, most active, optimistic, happy people that I've ever known. I mean, even in this picture, if you look at it, she can't help but smile. She doesn't have any signs or symptoms of mental illness or any history of mental disorders. She exercises, she eats healthy, she meditates, she gets enough sleep. She's doing everything right, but she's still struggling with her mental health more than she's ever experienced in her life. And she wanted me to share this story with you all today because there really should be no shame in what she's experiencing. It's a human response to the unprecedented levels of stress that all of us and all of our employees have been experiencing over the last year. In fact, her story isn't unique. Right now, 41% of adults are reporting diagnosable mental health conditions. So out of this Zoom room that we're in right now, that's almost half of us could use professional help right now. And it's no wonder why, because if we look at the state of our world right now, these numbers are from the American Psychological Association. They represent the percentage of people feeling overwhelming stress from these issues. So we have this list of new stressors that have come upon us in the last year. But that doesn't even count the stressors that have been there prior to COVID, right? And prior to all of the crazy political things that have been going on in the world. We had all of these pre-existing stressors before. So we were already on the verge of a mental health crisis before 2020 hit us. And that has basically just lit everything on fire, put mental health into, the spotlight. And we have all of these mounting pressures, and then we just added a bunch on top. So that's kind of the situation that we're in. That's why so many of us are struggling. So I'm going to let Haeli go into these next slides, and Haeli, go ahead.
Okay. Yeah. So before we go further into the session about breaking down stigmas, let's talk a little bit more about what mental health is. Before we go into that, though, I do want to ask a poll question so I can understand how big of a priority mental health is at your company right now. Okay, let's see. So it looks like most people are responding with 7 or 8, which is pretty high. I do know, especially working in the mental health field, that this has been a very big concern, especially over this last year. Okay, oh, it was a tie with 7 and 8 together. So let's talk about mental health. I always think it's really important for people to know what mental health is. I love this explanation from WHO, the World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Mental health has to do with our mental and our emotional well-being, and it significantly impacts our lives in various ways. And also keeping in mind that various factors can impact our mental health, such as family history of mental health problems, genetics, your own brain chemistry, also life experiences, such as your upbringing, any trauma that you've experienced, or any type of stressors that have happened in your life. Those things also impact mental health. So why does mental health matter? Our mental health, it's important, as you know, as the WHO's explanation just talked about. It's how we handle and cope. Well, here's how kind of mental health works. It affects our emotions. It affects the way we feel and the way that we manage how we feel. It affects our thoughts. It heavily impacts our thoughts, the way that we think and what we do with those thoughts. And then based on those emotions and thoughts, it affects our behaviors. It can change how we react to what's inside us, as well as what's around us. And then these are also going to have an impact on our health. We do know that mental health is directly correlated to diseases and to our overall physical health, and vice versa. Our physical health can have impacts on our mental health as well. So we're not just talking, we know that mental health during COVID has been very impacted. We've seen a really big increase, but we're not just talking about mental health this last year. I love in a way that mental health got so much recognition this last year, but this has always been a problem. And so it kind of put it more in the forefront. And we know from the American Psychological Association that this mental health crisis that we have seen come to the forefront, we are going to have serious health consequences for years to come. The mental health field, we are prepared for at least 10 years of what's happened over this last year to be affected for people and their mental health. It's not like a vaccine. There's not a vaccine for this that's just going to make everything go away. These issues were here before. COVID-19 brought more to the surface, and we're going to have all of these issues still once COVID-19 is over.
Yeah, I definitely agree with that. And that is what we're seeing is like, even as the world's kind of getting vaccinated and places are starting to open up, there's like, they're talking about like the effects of burnout now and how that prolonged stress is affecting people for a long time. So I'm going to talk a little bit more about the employer side of this. So why, as an employer, why should this matter? You know, why is this a priority for your company? You know, so what if your employees are struggling with mental health? Why does that play into the business? So I'm going to throw one more poll out there. If I'm just wanting to get a feel on the state of mental health at your guys' companies today. So we're going to throw that up and give you a couple seconds to answer that and just see kind of where you would rate your, you know, on a scale of 1 to 10, what is the state of employee mental health at your company today? So 1 being the worst, 10 being the best. Where is everybody at? It's like 5 is kind of leading the way. So people are kind of just in the middle. It's where they feel like everybody's at. So, okay, so that's good. So mental health care, yeah, it looks like 5 is the winner. So perfect. Okay, so you guys are kind of right in the middle. So mental health care is expensive. It's actually now the most expensive condition with the highest economic cost in the US. So even more expensive than heart disease, right? We've, for the last 20 years, been super focused as companies on physical well-being, physical wellness, physical health, biometrics, you know, wellness programs, yoga, fitness, all of those things, smoking cessation. But now we're saying, okay, the data is showing us the mental health care is now more expensive than all of that we've been super focused on for the last 20 years. So mental health care is going to be first and foremost in organizations moving forward. We're going to start to see more of that as companies see that come in their top expenses. So we have a couple large employers that we work with. And one of them was telling us the other day, they have about 12,000 employees. And they were telling us that mental health care costs were in their top 5 expenses as a company. So it really is like real data. This doesn't even include what it costs employers outside of healthcare and in other things like burnout or caregiver fatigue, substance abuse, all of those things, can't even be measured in this graph. But what is interesting too is the causes of mental health issues. You can see in purple right here is just what brings on a lot of these mental disorders is that stress, exhaustion, overwhelm, and burnout, which are the big hot topics right now that seem to be kind of the root of a lot of these issues. And let's not forget how mental health affects job performance. So this is a study done by Harvard Medical School. They measured absenteeism and lost productivity or presenteeism. They measured it across like the 4 most common mental disorders. And so between absenteeism and lost productivity, we're seeing almost 35 work days lost per person with a mental illness. So that's about 7 work weeks in a year, which is pretty significant, almost 2 months. And we know that this is affecting about 41% of the population right now. So this can add up to quite a bit of money and quite a bit of lost time. So, and then there's also things that we can't measure as well, like destructive leadership, negative social interactions, the detrimental effects of poor mental health on culture and morale, and those things that you guys in HR are still focused on wanting to improve and manage and cultivate. So it definitely is a very, very serious subject that companies need to be really focused on. So the way it kind of manifests itself in the workplace and what you're going to see is this kind of the most common are difficulty concentrating. It's a symptom of both anxiety and depression and results in employees being less focused, unable to complete tasks, or maybe getting the job done correctly without errors. And then also sleep disturbances. That definitely affects people's productivity and as well as carelessness, mistakes, and increased work days missed. So they're also more likely to have physical issues, chronic illnesses, sickness. I mean, basically every disease ever is tied to negative stress in some way. So, all of these things just come back to their ability to perform at work. And out of all of your employees, so we know there's like 41% of people are struggling right now. Well, out of that 41% of your company, half of those people will never ask for help. So they need help. There's a million reasons why they're not getting it. So how do we make this easier? Well, to make it easier for employees, we really need to understand what is getting in the way. So the barriers preventing, this is a super interesting study by the World Health Organization. They polled people who needed mental health care but did not receive it. I think it was like 10,000 people. And so they were able to say, okay, here's the reasons why people that need care are not getting that care. And first, we looked at structural barriers. So about 24% of people that they polled didn't get the mental health care because either A, it was expensive, B, lack of availability is a huge one right now, right? So there's just like so many EAPs are backed up 6 to 8 weeks. I hear all the time in meetings, it's like they can't get in. And there's just seems to be like a mental health care shortage going through those traditional routes. And then, transportation, if it's someplace they have to go in person, and then just that inconvenience of having to travel. But what is the most prevalent is actually what we call attitudinal barriers. And so those are things like stigma, which is alive and well in the workplace. Employer confidentiality. So a lot of people are just concerned like, hey, I don't want to go to HR and tell them I'm struggling with anxiety. Is that going to put my job at risk? Or it's embarrassing. They don't want to share that with their employer. They maybe think it'll just get better on its own, or maybe they don't understand how effective different types of therapy can be and how quickly they can get back to feeling good. A lot of people just don't understand what's done. You know, their experience with mental health is like what they've seen in the movies, and they don't understand there are lots of different types of therapy and lots of different ways to get people back to feeling their best. So there's just a huge educational gap. And as we overcome that educational gap, I think we overcome a lot of that stigma and a lot of these perceptions that people have around mental health.
So let's talk about what you can do. How can you best support your team? Let's ask our last poll question. And this is around how mental health has shifted as a priority for you in your role in the last year.
Yeah, and it's actually 2 questions, so just make sure you answer them both.
Sorry. So yeah, the first one's has your approach to employee mental health changed in the last year? And if your answer to the previous question is yes, how has your approach to mental health in the workplace changed?
And Kira has a question in the Q&A. She said, one thing I hear a lot is that there's no easy way to find a therapist. Do you have any suggestions? So I don't know if you want to answer that, Haeli, or I can.
Do you want to go ahead and answer it?
Yeah. So what we've seen is that a lot of, especially like on the EAP side, a lot of EAPs just have very limited resources. And so it has been a huge issue for people to try to get in with somebody relatively quickly. If you're having a mental health crisis, you do not want to be like, okay, yeah, let's set up an appointment for 6 weeks from now. That works really great. So as far as like easy ways to find a therapist, there are lots of companies that have a digital solution. More and more mental health companies are coming out of the woodwork every day. So we operate in that space. So the Zenivate solution, I mean, people can use our app and they can just go and book with a therapist within 24 hours. But there's lots of other companies out there. There's like Ginger, Lyra, Modern Health, and there's lots of options out there. So what we've seen work the best is when an employer is implementing some sort of an on-demand digital solution for therapy, and that kind of eliminates that issue of like finding a therapist. Because a lot of times with the digital ones too, you can like select who you want to work with, see their background. You have a lot more control over your care than you do with a traditional EAP. So yeah, I hope that answers your question, Kira, and I'll give it back to Haeli.
Okay, so I'm going to look at this poll. So has your approach to employee mental health changed in the past year? We had 86% answer yes, which, wow. And then the second question was, no, I lost the second question. I'm only seeing the first poll now. Oh, there we go. Sorry. Okay. If your answer to the previous questions, yes, how has your approach to mental health in the workplace changed? Almost half responded talking about mental health more at work, which I love, and we're going to talk about that. We also had pretty high responses in implementing an EAP or wellness program. Offering employee counseling was pretty high, allowing flexible work hours, and providing other mental health resources. So that is great to hear. I love hearing those things. So we're going to talk about ways that you guys are able to support your team. And one of the biggest ways is by removing that stigma. One of those attitudinal barriers that we discussed is to change the way employees think about mental health. And that's why I love that you guys said you're talking about it more. We want to change those attitudinal barriers that are affecting 96% of people who don't access care. In order to do that, we need to normalize it. There's 4 key ways to break down stigma: sharing and normalizing, making care and options more easily accessible, giving employees more options for care, and providing tools to help manage mental health proactively. We're going to dive into each of these a little bit more. So let's start with sharing and normalizing. The biggest step to normalizing mental health is talking about it. It is so important for us to talk about it. It also helps to learn about it, which we're going to do here today, have conversations around it, get leadership starting those conversations, teach about it through trainings and workshops. We as Zenivate are seeing more and more companies doing wellness fairs, and they're talking about it and offering these learning opportunities. Other ways include training managers on how to have conversations around mental health. We do at Zenivate, we have specific training options for HR as well as managers on how to have these kinds of conversations. Also having the conversations around all the various options for help. Providing that space that is confidential for employees so they feel safe and comfortable. And if possible, one of my favorites is providing mental health days to really show employees that we do care about your mental health, because we know it is so important for us. So let's learn about mental health a little bit more. These are some of the common mental health issues that we see. Common conditions, and there are a few more that could be added in here, are depression, anxiety, PTSD. These are some of the really big ones that we've seen increase this last year, especially, along with some issues including substance abuse, suicidal ideation, relationship distress, and domestic violence. So I want to talk about those 3 conditions because it does help for us to learn about it and to know what these conditions look like, to see how we talked about how those symptoms are impacting the workplace, difficulty focusing. And so you'll be able to see the symptoms that we see as therapists to diagnose the disorder, and then you can see how that trickles into the workplace. So let's start with depression. So these are the symptoms. I just took these from our manual that we have. Diminished interest or pleasure in activities, appetite disturbances. So it could include decrease in eating or eating a lot. Sleep disturbances. Again, it could include sleeping too much, not being able to fall asleep, not being able to stay asleep. Can look different for each person. Psychomotor agitation. So moving really fast. There's also just really moving at slow pace. Fatigue or loss of energy. This is a really big one that we see a lot of. And then as well as feelings of worthlessness, as well as hopelessness, just no hope for the future, or feeling that you're not worth anything, that you don't contribute anything. There's also a diminished ability to think or concentrate. And that's one that will very well show up in the workplace, and as well as recurrent thoughts of death. So those are some of the symptoms from depression. Now let's talk about anxiety. Anxiety includes excessive worry, restlessness, easily fatigued, difficulty concentrating, irritability, which I do also want to say with irritability, mood swings, anger, that is something that we also see in depression as well. It's not necessarily a symptom that's called out, but we do see it very often in depression. As well as muscle tension, and again, sleep disturbances. So people, both of those, depression and anxiety, that difficulty concentrating, those sleep disturbances. People with anxiety will also have struggles with when it comes to eating. And so in both of those disorders, we're seeing struggles with eating. And oftentimes depression and anxiety kind of go hand in hand. A lot of times people that have depression have anxiety and vice versa. Not always, but anxiety is the #1 mental health disorder in the world that we diagnose. It is the #1. It is also the most treatable disorder. So anxiety is a very big one that we have, and especially that we're struggling with right now. And then let's go to this last one, PTSD. And I'll tell you why I put PTSD in here. PTSD, post-traumatic stress disorder. So a lot of people that have experienced some type of traumatic event in the past, there were a lot of issues during this last year that triggered that PTSD to come back. And then some people that had never experienced some of those symptoms before because of things that some of them went through this last year, it did bring up some of that, those trauma responses, which is very hard for people to work with once they're struggling with this PTSD. Some of the symptoms that we see in PTSD include recurrent unwanted thoughts of the event, nightmares, upsetting dreams about the event. So again, people struggling with sleep, emotional distress, especially when something reminds them of the event, even a physical reaction to when the event, when they have a reminder, having negative thoughts about themselves, hopelessness about the future, difficulty with relationships, and sometimes people detach from family and friends. So we do know that these three common symptoms, in looking at all of those symptoms, those three conditions, in looking at these symptoms, we do see how the symptoms are impacting our employees' ability to work. So now that we know more about mental health, what can I do to help an employee? That's a big question, what people are here for. So how we can support our team? Well, you guys are taking a really big step in learning, understanding the signs and the symptoms. We talked about creating a safe and confidential space. One of those barriers is because people are so worried that what they discuss isn't confidential, especially at work. If they go to someone in HR and say, hey, I'm struggling, there's that concern that it's going to get shared. So really trying to make sure that your employees know that it is a confidential place, which in turn, that's going to help them to want to share what's going on, especially if we're talking about it more and showing our employees, hey, this is important to us. It is going to make them feel a little bit more like they can share. And there are a lot of people that are struggling that just don't know how to start those conversations. And when someone does come to us, it's really helpful for us to use good listening skills, which includes learning what to say and what not to say, which we'll discuss. And then also, it is really important for you to be taking care of your own mental health. We cannot be in a place to help others as well as if we're not in a good place mentally. And then providing employee education.
I can't tell you how many times too where I've met with somebody in HR and they are just like run down, exhausted. They're carrying the weight of all of their employees' issues, people, you know, going through divorce or people that are struggling with anxiety, because there is like the small percentage of people, like 4%, that will go to HR and tell them. So HR is carrying all of those burdens. So I just want to reiterate what Haeli's saying is like, yeah, absolutely. You cannot help your team if you're not taking care of yourself, because you just have nothing left to give, you know?
Yeah, and that's why, I mean, we talk about this stuff in groups a lot where you have your bucket, and if your bucket is empty, there's nothing you can give to other people. You cannot fill other people's buckets in any way. And so it is important for you to be taking care of your own mental health. And I was just reading the chat while Amelia was talking right there and talking about the tennis player that dropped out because of her mental health. And I do think that's great that we're starting to see more and more people do that, and more people say, hey, I need to take a break. I need to stop, and know that that's okay for you to do as well. You know, you can say, hey, I need to take a break for my mental health. And when employees are seeing, you know, HR and leadership do that, they're going to feel more empowered to be able to say, hey, I'm struggling too. And it's going to be able to trickle down into the company.
Yeah, it definitely has to start at the top. And did you see the question from Kareem Simon on the chat? He says, how do we identify coworkers who may be struggling with mental health issues who don't come forward, that there's a tragedy at the workplace because that person has exploded by shooting up the workplace? Like, how do we recognize the employees who are really struggling And I think some of that is talking about like learning about those symptoms and recognizing people that are exhibiting those symptoms. But Haeli, do you want to talk about that a little bit more?
Yeah. No, and I think that is part of it, is learning some of those symptoms. You know, if we're seeing those mood swings, if we're seeing irritability and anger, if we're seeing people, especially when they start acting out of their character, that is a big sign to me when I see people not, you know, being themselves, that, hey, something might be going on with them underneath the surface. So it is kind of knowing who they are, but then understanding, you know, also if they're missing a lot of work or if they're always angry at work, there are those little signs that will show us something's going on with their mental health. And then of course, there's only so much we can do for ourselves. For employees that are struggling, we can offer and talk, but we can't force people to come talk to us. But it does help if we're talking about it and we're saying, hey, mental health is important to us as a company. Then those employees are going to more likely feel like, okay, they care about my mental health. I can go share maybe something's going on, or ask for help, or ask for some time off.
Okay, great. Yeah, and I know we're running shorter on time. I think we've got about 15 minutes left. So I want to make sure we get.
Well, yeah, and that's what I was just saying, is when somebody does come to talk to you, these are some key things of what to say and what not to say. You know, I'm here if you want to talk, versus why don't you just snap out of it, or just stop thinking about those thoughts and move on. We can ask things like, how are you coping with these thoughts? And you guys can read more of these. What not to say, why are you being so negative, or just look at the bright side. You know, we can ask, has work been stressful for you lately? Or what do you do to take care of yourself? Which I love that one. So talking about mental health best practices, it's really important for you guys to educate yourselves. Part of what you're doing, following mental health resources, also setting the example like we talked about, prioritizing your own mental health is very important. Establishing a meditation time for your team. If you're working in person, you can meditate together. If you work virtually, you can have some meetings where you do that. And then asking employees how they're really doing. Oftentimes we say, oh, how's it going? Good, good. And that's where it goes, you know, instead diving deeper as to those things that we talked about, what to say. How are you really doing? What's going on? How are you handling, you know, the stress that's happening at work? So those are just some mental health best practices that we have.
Yeah, and I think even with my own team, like in our one-on-ones, I always try to ask questions about like, yeah, how are you handling your workload right now? Do you feel like you're burning out? How's your employee managing your family and your life balance there? We have a lot of female, we're like 75% female at Zenovate. So we have a lot of like working moms. And so these are conversations that are super critical for us. It's just making sure their workload is manageable for them and for their family. But it is a lot of checking in, especially in the virtual workplace. I don't know how many of you are like staying virtual or have been forced to go virtual and plan on coming back. But when we're not like in the office with people rubbing shoulders, sitting at the water cooler, having lunch together, it's a lot harder to have that read on how they're doing. And so these questions in one-on-ones with managers become more and more critical because those are your only touch points. So I have a few other things that help remove barriers to the stigma, talk a little bit about what I've seen work really well for some of our clients. And we kind of touched on this already, but you know, the biggest thing is making it super easy and accessible. So how do you make it easier for them to access the help? You know, it needs to be simpler. It's been harder and harder to find therapists in network through health insurance. So we've seen a lot of companies start to go outside of insurance and adding that additional layer with some sort of an on-demand teletherapy solution, because yeah, it's really hard. A lot of those therapists are just booked because there's so much demand. Therapists out of network, you know, there's a lot of different options as far as communication as well, like text therapy, email, you can call on the phone, you can do Zoom. So you can kind of give them a lot of different options as far as how they can interact with a therapist. A lot of times with a traditional EAP, people don't hold on to that information when they get onboarded. And so then they have to like go to HR and then ask for that information. And so most people stop right there and just don't take that first step. Then if they do go to HR, it's like a 1-800 number they have to call, and then they give them like a list of numbers to call, and then they have to go call all those places, find availability. And people do just give up. Like we've heard story after story where people are just like, it was too hard. And then I know a lot of employees have had a hard time with I heard somebody describe it to me the other day as it's like, well, they just give you whatever name comes out of a hat that they draw for the day. So there's like definitely a control and ownership over who is providing care for you is a concern for people as well. So just the more steps we can eliminate in this process in general, the more likely they will be to reach out for whatever help that they do need. So yeah, and like I said, there's a lot of different solutions for that. So, and then just providing more options, in person, teletherapy. A lot of people, what's interesting on our platform is we pulled all of our data and we have a whole mental health library of pre-recorded videos. We also have like fitness and yoga and meditation and stuff. But if you look at the data of the people who use the video mental health versus like actually accessing teletherapy, they're actually two totally different populations of people. And so what that has kind of shown us is it's like not everybody's ready to talk to someone. So what other options are there for the people who aren't ready to kind of come forward and have a conversation? Maybe they're willing to watch a video. Maybe they're willing to download an article or read about it or sit in a training on mental health that you provide for your employees. Like there's so many different options, but it's been really interesting because everyone's kind of at a different level. It's not like everybody's like, oh, I'm ready for therapy right now. So being able to provide different options. Some people aren't open to therapy, but they'll work with a coach. So life coaching, we've seen that like we'll have people that'll work with a life coach because it doesn't feel like I'm broken, I need therapy. I mean, that's just fighting against that whole stigma is like, you only go to therapy if you are struggling with a diagnosed mental illness and really sick. So just kind of overcoming that. So we have seen an increase in coaching kind of as an alternative to therapy. And then just making sure you have access to any kind of crisis care, whether that's like a 24-hour phone number or app or, text line, whatever that is. And there are free ones. And if you guys like visit our booth later, you can actually get these slides, and we have a mental fitness toolkit that you can download for your employees. And it has like all of the resources in there of like all the free lines and text to chat and all these things that are available just through the government. Don't even cost anything. All right. And then another thing that we've seen is kind of integrating these other types of practices has been really beneficial. Kind of combining mental and physical health and giving people these like little baby steps. So maybe somebody's not ready to talk to a therapist today, even though that might really help them, but maybe they're open to just learning basic breathing exercises, right? So they can manage their stress and anxiety and find moments where they can just take a break, breathe, reset, and just kind of prevent themselves from getting to that crisis level in the first place. So we've kind of seen like mindfulness is kind of breathing, meditation, and yoga. You can do any of those, bringing those into your team members. There's probably people on your team who know some of these things that you can just pull in and have them do a workshop that wouldn't even cost you anything. And then kind of introducing people to coaching, and then therapy kind of being the goal of getting people the help that they need. So, and Haeli, it's you.
Okay, we'll just run over this real quickly because I love in that last slide, Amelia brought up mindfulness about being, breathing, meditation, yoga, and people don't realize how much we use mindfulness in therapy as well. So it's shown that mindfulness actually does improve mental health. It's used in evidence-based therapy treatments like dialectal behavioral therapy, mindfulness-based cognitive therapy. We use mindfulness as a treatment. We really do. So this definition is, what is mindfulness? Calmly acknowledging and accepting one's feelings, thoughts, bodily sensations, used as a therapeutic technique. That is from the dictionary. Some great ways to practice mindfulness include using the 5 senses, using your breath, and meditation. And that's also why we suggest, hey, take a minute and have some times where we can provide a meditation, mindfulness practice place for our employees. If you don't want to use the word meditation, I completely understand. And so mindfulness practices, Amelia, if you want to go to the next slide, research is finding that it is having positive impacts on mental health. It's reducing symptoms of depression and anxiety, and it's linked to more positive health behaviors. Mindfulness practices can be done in yoga, can be done in meditation. The mindfulness exercises, like using the 5 senses, and the breath work. Breath work is also shown, it is being studied more and more, but it is being shown to reduce levels of anxiety. It is why so many people focus on that breath work piece. So finally, we'll talk about your proactive care, looking at how to manage your mental health. This list includes many of things that therapists would suggest for you to take care of your mental health. In therapy, yes, we do process, we do work through things, but we also encourage our clients to take care of themselves physically through nutrition and exercise, practice the breathing exercises, mindfulness meditation, and doing healthier self-care routines. This is what is considered more of that holistic approach. We're looking at the whole person because we know that these things all impact a person's mental health. And so we did want to provide some tools for your own self-care. Self-care is doing things that recharge you, that fill your bucket, like we talked about. These are things that fill your bucket. It's going to look different for everybody, but things do include things like healthy diet, going to the doctors regularly, exercising, having a healthy sleep routine, time for relaxing, having a healthy support system, keeping regular schedules, or maybe reading or journaling, turning your phone off, which is part of creating healthy boundaries. Having healthy boundaries is self-care. Doing things to decompress and things that, finding the time for things that you enjoy. And again, also encouraging employees to do self-care. It's not just, oh, mental health. We also want to look at that whole person and saying, what are we doing to take care of our bodies physically and mentally? They do go hand in hand together.
Yeah, and a lot of clients we've seen putting together just like workshops and events for their employees where they're teaching them some of these principles and things like that. So I think that's one of the things that's pretty cool about the mental health movement we're in right now. There's just like so many opportunities, especially because a lot of us are working virtually, to bring people in a Zoom room and be like, yeah, let's present this to our team. Let's work through different ideas. What are people doing that works for them? So we facilitate a lot of those conversations as well. But we've only got a couple minutes left, and it looks like we have a couple questions. First, Brittany Hoffman asked, how do we find the best online therapy source? There seem to be a lot of them, and they are more accessible than EAPs, but how do we know which one might be a good one? So I would say, first and foremost, I'm like super biased because this is exactly what we do. And so I think we're pretty awesome. But whatever you do when you're looking for a solution like this, you need to ask for what are their utilization rates? How many employees in an organization should they expect to be using this resource? So traditional EAP, the average is 4.5%, the national average according to SHRM. And then, using our platform, I can tell you that we're looking at between 20 and 30% of employees are going to use our teletherapy services. So you want to get utilization rates, you want to get case studies. So like, let's see some of the clients you've worked with, what's their actual data? And then I would definitely ask for a couple references. So we send potential clients to our existing clients all the time and like have them actually share what their experience has been. So I wouldn't just like jump into somebody. I would definitely do your homework and compare the options that are out there and really look at the data. I think that really matters the very most. So that is my answer. And then Marian Arlen asked, how do you deal with employees who need to take time off work to address their mental health, but who refuse to take a leave of absence because they've already used up their sick time and vacation time, so their leave would have to be unpaid? Haeli, do you have any advice on that?
It's so hard because we cannot make people do something. It is outside of our control. We can always suggest and try to offer what help your company the company resources and make sure that they're able to use those. But there really is only so much you can do. And I always, when I run HR groups, we do talk about that. Like, there's only so much that you could do. And once you offer the solutions to the employee, that is partly in their hands where they have to make that decision.
Yeah, and we're out of time, so we have to end, but just head over to our booth if you guys want these slides, or you want our mental fitness toolkit, which is just a free, it's like a 7-page PDF with a lot of these takeaways and resources in it. So hop in there. We've got 3 of our team members at our booth ready to help you with whatever you need.
Yes, thank you. I'd like to thank our sponsors, Zenovate, and presenters Haeli Harris and Amelia Wilcox for presenting this very informative webcast today. And thanks to you for attending. Your feedback is important to us. Please take a moment to fill out the exit survey that opened in a new browser page on your computer. You do have a few minutes before the next webcast begins, so you can visit the exhibit hall or grab a fresh cup of coffee or whatever your beverage of choice may be. We'll be sending you an email with the credit information. You will also find the credits on your View My Credits page of your membership profile once the webcast has been archived. This concludes this webcast session. We hope you've been enjoying Inspire 2021. All virtual booths are available for the entire event, as well as a networking lounge, so take some time to look around and connect. Have a great day.